Invitation to speak at the 2021 Virtual CHW Summit hosted by Umemba Health. Umemba Health LLC is committed to the workforce development of frontline health workers. Our goal is to improve the health of individuals and communities, and this is accomplished through our mission, equipping the healthcare and public health workforce by providing continuing education and professional development training. The virtual CHW Summit was hosted for the first time during National Community Health Worker Week of 2020. The National Community Health Worker Week usually coincides with National Public Health Week. In 2020, the dates of National Public Health Week and the National CHW Week were April 5th through 11th, and the summit was held Monday through Friday, April 6th through 10th. The theme of the summit was preparing community health workers for COVID-19 response. The summit consisted of 6 presentations and 1 live Q&A session over 5 days. A total of 6 CEs were awarded to summit participants that attended all the summit presentations. The theme for the 2021 summit is elevating the multidimensional skill set of community health workers. The goal of the summit is to provide continuing education, provide professional development, and provide networking opportunities for community health workers and community health worker instructors. What will be different about the 2021 summit is there will be emphasis placed on presentations that focus on new skill development to tie into the theme of elevating the multidimensional skill set. The summit will take place again during National Community Health Worker Week. The days will fall on April 6th through 9th, which is a Tuesday through Friday. Summit presentations will last a total of 3 to 4 hours each day. There will be 1 daily keynote for an hour. There will be 4 session presentations at 30 minutes each. There will be an optional CHW instructor session, which may be 30 or 60 minutes daily, and 1 live Q&A session daily, which will occur in the afternoon or in the evening. So this is the call for speakers and what we're looking for to help create a successful CHW Summit next year. There are 4 summit tracks. Track 1 is titled Stories from the Frontline. Track 2, Health Equity for All. Track 3, The New Normal, Living During a Pandemic. And Track 4, Professional Development for CHWs. Again, there will also be a daily bonus session for community health worker instructors. The keynote presentation will be 60 minutes and equal to 1 CE. The session presentations will be 30 minutes and equal to 1/2 CE. And again, the CHW instructor sessions can be 30 to 60 minutes, and it will be based on the proposals that are submitted from speakers. Here is an idea of the tentative schedule presented in Central Standard Time. The daily keynote presentation will most likely start at the lunch hour, so about 12 to 1 Central Standard Time, followed by the 4 30-minute session presentations, 1 to 1:30, 1:30 to 2, 2 to 2:30, 2:30 to 3, and then the CHW instructor presentation. The preference is 60 minutes, but it can also be for 30 minutes as well. Last, each evening we will have a live Q&A with the day's presenters, and that will most likely be a 1-hour Q&A session, most likely 6 p.m. to 7 p.m. Central Standard Time. As we get closer to the summit, we will actually put up the time frame of the summit and all of the sessions and presentations, and we will do it based on the different time zones here in the U.S. So track 1, Stories from the Frontline. Some ideas of speaking topics that we're looking for are case studies pertaining to CHW programs, projects, initiatives, etc. We're also looking for any kind of CHW research and the evaluation or outcomes of CHW interventions in that research. We're looking for program or project success stories and ideas that other CHW programs can take away and possibly create in their work environment. And then an overview of global CHW programs. So these are a description of what CHWs are doing around the world and the initiatives that they're using. Again, so maybe other CHWs and CHW programs or employers can see and replicate those initiatives. Again, we still need a topic that's specific to CHW instructors on this day one for track 1 as well. For track 2, health equity for all, some ideas of proposals that we're looking for relate to cultural competency, how CHWs can address social determinants of health, how CHWs can engage communities of color, how CHWs can help to address stereotypes or help to reduce healthcare disparities. Again, these are just ideas, and if you have a topic that falls under this track 2 topic of health equity for all, you're welcome to submit that topic as well. Also, again, a topic specific to community health worker instructors that falls in line with day 2, track 2. For track 3, the new normal, living during a pandemic, some ideas that we would accept proposal on are topics related to working in a remote world, virtual education, community engagement during a pandemic, or changes to workflow processes or programs due to COVID-19. Again, we welcome any topic that falls in line with this track, and we need a topic specific to CHW instructors as well for day 3, track 3. And then the last track and the last day is professional development for CHWs. Some ideas of proposals that we will accept include resume writing workshops, conducting a virtual visit, mastering the virtual interview, or CHW leadership and supervision. Again, we need a topic specific to CHW instructors as well that pertain to day 4, track 4, And then I just want to make sure that I emphasize that bonus session for CHW instructors. This can be a session for both CHWs and CHW instructors. However, we really would like to see some topics focused at how CHW instructors have revised their teaching and facilitation, especially in a virtual format. We would like to hear about some best practices, some outreach for CHW training programs and things of that nature. So it's really important that we get some speakers that can present so that other instructors across the globe can get an idea of how to reach and improve teaching and education for community health workers. Submission tips. Look at the summit tracks and the suggested ideas. Submit a topic that pertains to the summit tracks. Speakers can submit for up to 2 sessions or 1 keynote and 1 session. Now, if you have an idea for an in-depth course, webinar, or workshop that doesn't tie into any of these tracks, but it's something that you think would be beneficial for community health workers or community health worker instructors in general, please don't hesitate to reach out to Quisha at admin@umembahealth.com. How to submit your speaker proposal. First, you want to identify 1 to 2 learning objectives of your talk. Then include your description or your abstract. This is for the learner. It pulls toward the desired learning outcome, and it will also be used to market your presentation. Please include in your proposal 3 to 4 key takeaways. Specifically, how will the learner achieve the objective? How will the learning objective be accomplished? We also need your timed outline. This is required for CE, so 5 minutes for introduction, 15 minutes for workshop, 10 minutes for questioning, etc. Everything in that outline needs to have a specific time amount required beside it. And then your presentation needs to include 3 or more citations or references. Important dates and deadlines for you to remember. The call for speakers will be open from October the 1st to October the 30th. It will close on October the 30th. Please allow for 1 month before you are informed of whether or not you've been accepted as a speaker. Speakers will be announced November the 30th. December the 1st is the call for sponsors, vendors, and donors. The early bird registration for vendors for the CHW Summit will be from December the 1st to February the 28th. For speakers, donors, vendors, and sponsors, we will ask that you begin marketing and promotion of the summit January the 1st or the first week of January. Attendees can register early for the summit February the 1st through February the 28th. Regular registration for attendees will be March the 1st through April the 6th, and regular registration for vendors will be March the 1st through March the 30th. That's a lot to remember there, but if you have any questions, please don't hesitate to email. I also have a handout that's available that you can download under this video. Things to know before submitting your proposal. All presentations will be pre-recorded. The speaker must be available during their session time to respond to participant comments on the day of their presentation. Speakers must be available for a live Q&A on the evening of their presentation, and speakers must sign a speaker agreement. So a little bit more about the speaker agreement. Basically, it's going to say that you agreed to plan and record your session, that you agreed to develop your presentation with 1 to 2 learning objectives, 3 to 4 learning activities, 2 test questions. Can be more, but at least 2 test questions for pre and post testing. You will agree to provide at least 1 PDF handout or any other kind of takeaway for the attendees. You will respond to and engage with the learners and answer their questions on the day of your presentation. You'll agree to share social media posts of the summit at least 1 time per week to your social networks. And again, the marketing kit will be available January the 1st, 2021. You will agree to allow Umemba Health to use your bio and headshot on the registration page and for marketing and promotion purposes. And you'll agree to comply with the provided timeline and communicate early if you see a problem. If you are selected as a speaker for the virtual CHW Summit, then you will need to sign and date the speaker agreement by December the 1st, 2020. Speaker compensation. Keynote presenters will be compensated a $250 honorarium plus 40% affiliate commission. Session presenters will receive 40% affiliate commission of registration sales. So to submit your speaker proposal, please do so by emailing Quisha Umemba at admin@umembahealth. Your subject line should read speaker proposal. If you have questions regarding the summit or the speaker proposal process, email that also to Quisha Umemba at admin@umembahealth.com, and the subject line for your emails concerning questions should be call for speakers. Thank you for considering your proposal submission. If you have any questions, comments, or need additional information about Umemba Health, you can visit the website at umembahealth.com, or you can visit the academy at umembahealthacademy.com. Thank you.